Hi, my name is Alicia Gilmore. I'm a clinical dietitian in the School of Health Professions at UT Southwestern Medical Center. Today, we are going to talk a little bit about nutrition and multiple system atrophy. Kind of an overview of the talk today, just general diet recommendations. And then we'll also talk about recommendations specific to MSA, focusing more on strategies to manage the symptoms from MSA, like constipation, orthostatic blood pressure, difficulty chewing and swallowing. And then we'll touch a little bit about feeding tubes. And then we'll have a live question and answer after the presentation. So a question that I do get a lot is, what should I be eating? And I have to say that is a very good question. When we look at the current research out there regarding diet and multiple system atrophy, what we find is that it's very limited. There is not a whole lot out there as far as what my patients should be eating or how they can change their diet. The research is limited more specific to symptom management versus prevention or progression. But if we ask Dr. Google, they're still pretty limited. But if you Google nutrition MSA, you'll find that there's some information that does discuss calorie restriction. There's some information that supports following a neuroprotective diet, which is more fruits, vegetables, berries, nuts. But if you really look into the research and you find the articles talking about that, you'll find that it's not necessarily specific to MSA, and it's a lot more general as far as overall neurodegenerative diseases, and some support more dementia than anything. So when I talk to my patients about nutrition and MSA, one of the things we do talk about is the importance of maintaining weight and being at a healthy weight. We also talk about making sure that they're retaining their lean body mass. I encourage my patients to choose a diet that's full of whole grains, fruits, vegetables, and lean protein. We are what we eat. So when we eat good things, our bodies are going to function better and we're going to feel better. So talking a little bit more about weight is definitely a balancing act. Not enough calories can lead to rapid weight loss, which too fast a weight loss can cause a decrease in lean body mass. Not enough nutrition can also cause a decreased energy. My patients do feel more tired if they're not getting enough nutrition. On the flip side, we want to be mindful of how much we're eating. If we're not moving around as much, if our mobility has decreased, then we don't need as much calories or as many calories. So sometimes we fail to compensate for that, and we still eat, what we were eating when we were a little more mobile. So it's important to be mindful of your activity and how much you're moving. And if you're moving a little bit less, then you may want to think about, do you actually need all the calories you're consuming? Because sometimes too much weight can also affect mobility. So then we come back to the question of, what should I be eating? You're saying, Alicia, yeah, I get that, but what should I be eating? So when I think about overall nutrition and I think about what's helpful for us and what's going to maybe make the difference and help my patients, I come back to the Mediterranean diet. It's a diet that's full of whole grains, fruits, vegetables, focusing more on lean meats like chicken and fish, shellfish, dairy, and decreasing not so much red meat, not so many sweets, not so much sugar, but making sure that you're getting all these really good fruits and vegetables and whole grains. Because when you do read the research about the Mediterranean diet, you will see that some studies find that it does help with inflammation. Now, inflammation is a little bit hard to pin down about what that means, and there's different ways of measuring inflammation, but for some people, it can help with pain, it can help with how they feel. Regardless of that, the Mediterranean diet is in line with other diet recommendations for chronic disease. So let's talk about a little bit more about what that means. And so a good question is, we do need to increase our intake of whole grains. And the question is why? Whole grains are a great source of fiber, which support a healthy gut. It makes our GI system happy when we have fiber. Whole grains also are a good source of B vitamins, niacin, folate, thiamine, which can help convert food to energy. Also good sources of minerals like zinc and iron, magnesium. Zinc is good for wound healing. It's good for immunity, and studies have found when people have a higher amount of zinc in their diet, not from supplementation, but from diet, they may have a better immune system. And of course, iron can help with those red blood cells. Whole grains are also great sources of antioxidants and phytochemicals. Like vitamin E, for example, is something that's found in whole grains, and that's a natural antioxidant that's helpful for us. And that's something that can be eliminated when those grains are refined. So examples of whole grains include oatmeal. And when I think about this oatmeal, I think about, the big container with the whole rolled oats. Better source. But popcorn, of course, and this is more of the air pop variety or the unflavored. It is a whole grain though, good fiber. Millet, quinoa, which is now a little bit more common in our diet and in the grocery stores. Brown rice, whole rye, teff, wild rice, wheat berries, bulgur, buckwheat, freekeh, barley, and sorghum. And some of these things are a little more common. It might be a little more recognizable than others. So what do we do with these? How do we increase these in our diet? You can always sprinkle toasted oatmeal on cereal or yogurt, or you can choose oatmeal, as your breakfast instead of cereal. I like mine with some fresh fruit and just a little bit of honey. You can snack on air pop popcorn, once again, whole grain, also pretty filling and low calorie snack. Instead of using white rice, you can swap it out for brown rice, or you could try something different like quinoa or farro. You can add barley to vegetable soups. You can try using whole grain flours, such as a whole wheat pastry flour in baking. I have a bread maker that I use on occasion, and I'll usually swap out half of the white flour for whole wheat flour to increase the quality of that bread. You could also use stone ground corn tortillas rather than the white tortillas with your tacos. So moving on, we've talked about whole grains, so let's talk about fruits and vegetables. Again, good source of fiber. And these fruits and vegetables have different kinds of fiber. I don't know if you knew that, but there's soluble and insoluble fiber. Soluble fiber is like the glue. It kind of helps smooth things out, helps get things moving. And then insoluble fiber is the roughage. And so when you have a variety of fruits and vegetables, you get a little bit of both. These fruits and vegetables are also great sources of antioxidants, phytochemicals, vitamins. There's over 9 different families of fruits and vegetables, so they offer a lot of different things that are beneficial to health. And some studies show that increasing your intake of fruits and vegetables can also help with weight loss. So what makes that successful is that you replace those non-healthy foods with fruits and vegetables. So instead of having a snack of Fritos in the afternoon, maybe have a banana or have an apple, have some baby carrots and some hummus. And then the study also supports choosing those non-starchy vegetables. So starchy vegetables would be like potatoes or peas or winter squash. And if you think about how they feel in your mouth, they're a little starchier versus the non-starchy vegetables like lettuce and carrots and bell peppers and celery, all the cruciferous ones like broccoli and cauliflower. Great phytochemicals, but those kind of feel a little bit different in our mouth. They're not as starchy, and they're actually lower in calorie versus the starchy vegetables. So ways that you can increase these in your diet is keep them around, keep them in sight. If they're in your visual range, or if they're on the counter, you'll be able to see them and go, oh yeah, I really do want that banana. Or if you have them prepped in the fridge, like if you have some cantaloupe that's already cut up, or some bell pepper strips, cut up cucumbers, baby carrots. Sometimes having those in sight and just as soon as you open the fridge is a great way to help prompt you to increase your intake and to choose those. You can kind of sometimes set goals for quantity. Like every day, I'm going to try and have at least one fruit, one vegetable. And maybe that's a good goal for someone who's just starting. Or maybe it's just one piece of fruit every day. Sometimes having small goals is helpful. Overall, we want to try and have at least 2 servings of fruits and 3 servings of vegetables every day. And so a serving size would be a piece of fruit, kind of like a tennis ball size, not like the big Honeycrisp apples, but like the little small Gala apples, or a cup of cut up melon, or a cup of raw vegetables. 2 cups of leafy vegetables equals 1 serving because of all the air. Half a cup of chopped or half a cup cooked vegetable or fruit. And then 2 tablespoons of dried fruit is considered a serving because they're kind of dehydrated down, so you don't have all that extra water. So sometimes setting goals for variety can help increase your intakes. Every day you could say, I'm going to have 1 red, 1 yellow, 1 green, 1 red, or 1 citrus, whatever that looks like as far as fruits and vegetables. You can also incorporate these into your meal. So a stir fry is a very easy way to increase your intake. And depending on, how much you like to cook or not, they have stir fry vegetables already frozen that you can just throw in. Some grocery stores have them already, the stir fry vegetables already prepped. So if you like the fresh, or you could use the frozen. And then you could, the easy way, so you don't even have to cut it up, you just throw it in and be done with it. A nice salad is another way to increase your intake of vegetables. You can add a lot of different things to them. I like a very chunky salad with carrots and tomatoes and avocados and cucumbers. But it doesn't always have to be a leafy salad. It could be more of like a farmer salad with just, chunked up vegetables. Soups is another way. It's always easy to add just a ton of vegetables to that. You can always freeze those for later as well. So we've talked about whole grains. We've talked about lean protein. We talked about fruits and vegetables. So now we're going to go on to lean protein. Protein is the building blocks of the body. It makes up a lot of different things, including hair, muscles, tissues, our organs. It helps repair our body, repair cells, and makes new ones. It also provides essential amino acids needed for essential chemical reactions. There's amino acids that we do not make in the body, and so we are reliant on the food that we eat to contribute to that. So it's important to make sure that you have these lean proteins in your diet every day. So what are sources of protein? And keep in mind, this is not all inclusive, but there's animal sources of protein like fish and shellfish, poultry like turkey and chicken, red meat's anything with 4 legs. So that could be cow, that could be pig, that could be deer like venison, that could be goat. All of those are considered red meat. Vegetarian sources of protein, so soy, beans, nuts, nut butter, seeds, sunflower seeds, sesame seeds, the soy products like edamame, tofu, miso, beans like pinto beans or kidney beans, nuts like peanuts or almonds or the respective nut butters. Those are also good sources of protein. Dairy products like milk. There are some milk alternatives that have protein like the soy milk, cheese, yogurt, eggs. And then there's other sources of protein as well. So not just the natural sources of protein, but there's protein powders out there that can be added to smoothies or casseroles. There's protein bars, there's protein shakes. And then there's also meat alternatives as well. If you think about like veggie burgers or vegetarian sausage, for example, those could also contribute to your overall protein intake. Lean protein is needed to retain our lean body mass. And so that's our muscle. And unfortunately, as we age, we tend to start to lose it. There's some studies that say that this happens around 40. There's some studies that cite even less. So as we age, aging is a state of low lying of inflammation. So we have to make sure that we adjust and get a little bit more protein. It's not a significant amount, but it's a little bit more than what we would need before 40. However, it's important to make sure we don't get too much protein. Too much protein, if we are not able to utilize it, can convert to storage. So kind of a nice rule of thumb is about 7 grams of protein per every 20 pounds of body weight. So this is a rule of thumb. It is entirely possible that you might need more than this. If you have other things going on, you might need a little bit less. This is something you want to talk to your dietitian about. But if we were to kind of crunch the numbers, if you weighed about 20 pounds, so that would be 20, 40, 60, 80, 100, 5 times 7. That's about 35 grams of protein. Not a whole lot, a little bit low. That's probably the minimum. Most of us probably need just a little bit more than that, but that's kind of a nice place to start. Again, talk to your dietitian about your specific needs. So that kind of talks about overall general recommendations for diet, things we want to think about. We want to make sure that you're getting adequate protein to hold on to your lean body mass. You want to make sure you're getting good fruits and vegetables because our body needs those essential vitamins and minerals to help things function. You want to make sure you're getting whole grains because those also have antioxidants and those B vitamins that we need. We want to make sure that we're getting sufficient nutrition to keep a healthy weight and not too much that contributes to a little bit of extra storage. So these are just some things that come up pretty frequently with my patients. So I thought we'd talk first about constipation. This is something that I think I talk about with almost all of my patients. The first thing I do ask them is making sure that they're drinking enough fluids. If you're not drinking enough fluids, that can keep things bottled up. And then we talk about their diet and making sure they're getting enough fiber. And we've seen these before, making sure you're getting whole grains, which are good sources of fiber, legumes, those fresh fruits and vegetables. You could also use frozen. Those are fine, and canned as well. Sometimes we'll recommend supplemental fiber like Metamucil or Benefiber or Citracel. There's different kinds of fiber supplements out there. And so all of them work a little bit differently, but all of them require water in order to work. So if you read the label, you always see that drink at least 8 ounces of water with the supplement because it's got to use that water to work. And anytime I work with patients that are wanting to increase their fiber intake, I do recommend that they add slowly over time. Trying to get that 30, 35 grams of fiber in a day, if you have only been eating about 11 or 12, which is what the average intake of an American is, sometimes can lead to discomfort and some gas and some bloating. So this is something you want to work on over days of time. Other things we talk about with constipation is sometimes you need a little bit of a push. So using prunes or prune juice or plum juice, we've rebranded the prune and now it's plum. This is actually, I like this. It's pretty tasty. You gotta be careful because it goes down pretty quickly. But sometimes a little bit of prunes or plum juice or prune juice can help get things moving. This is a product called Smooth Move Tea. The ingredients are here. One of the most ingredients are listed by weight. So this has senna, which is a natural stimulant. And so also the tea, which is hot, along with a stimulant, can get things moving as well. Some patients find that probiotics are helpful. You may have heard of a yogurt called Activia. I've had some patients find that this is beneficial for them. There's other products out there. These are just some of the common ones. Not necessarily one that I'm not supporting, but these are some of the ones that my patients have told me have worked for them. And then there's something called power pudding. And you can mix together a cup of applesauce, a cup of oat bran or unprocessed wheat bran, and 3/4 a cup of prune juice. So you mix it all together. You can store it in your fridge, or you can put it in like a ice cube tray. So it's portioned out, and stick that in your freezer and then pull it out. Start out with 1 or 2 tablespoons with 8 ounces of water, and then you can increase gradually as needed. So these are just some of the more common over-the-counter remedies that you can try. If you are trying things and these have not been helpful for you, please talk to your provider about other recommendations to help manage your constipation. If you're constipated, sometimes you don't eat as much, you don't feel as good, you can feel full. Over time can lead to further complications. So the next thing we talk about is salt. So salt is something, in a diet high in salt may help patients with orthostatic hypotension. My caveat here is you want to talk to your doctor about this to see if this is appropriate for you to do. Overall, most Americans eat about 3.5 grams of salt. So what does that look like? If you look at my table, 1 teaspoon of salt is about 2,300 milligrams. 2,300 milligrams is the recommendations from the American Heart Association for what we should be on average consuming for overall heart health and prevention of chronic diseases. The Mediterranean diet that I talked about earlier recommends less than 2.4 grams. So 2,300 milligrams is right there too. For someone who has orthostatic hypotension, the guidelines just say more. And so that can be anywhere from 3 to 8 grams. Once again, talk to your physician if this is appropriate for you. But if it is, then how do we reach that 3 to 8 grams? Well, it's staring us right in the face. Processed food. There's a lot of sodium in processed foods. So looking for things that are in packages, bags, boxes, cans. Those are some ways that you can increase your sodium intake. There's also some rehydration solutions out there that have sodium as well. Some of them have about 500 milligrams per serving. So if this is something that has been recommended for you and it's appropriate for you to do so, getting that 3 to 8 grams by choosing more processed foods may be doable for you. The next thing I want to talk about is fluids. And usually when I ask my patients how much fluid they're drinking, I always get the answer, not drinking enough. And I understand that there's reasons for that. Some is related to mobility. But what we found is that with not drinking enough fluids, that can lead to UTIs. And the stats show that people who have had UTIs before, at least 50% will have recurrent UTIs. So the recommendation is about 50 ounces. If we look at the research as far as how much fluid we should be drinking, it is variable. But this actually does support about 50 ounces of fluid a day to help prevent UTIs. It may also help with orthostatic blood pressure. So what they found is that patients who drink 16 ounces of blood pressure, it can actually increase their blood pressure by 30 to 60 millimoles. It does wear off in about 30 to 60 minutes. So the research says that you could do this before an event. But this is, again, something you want to talk to your physician about if this is appropriate for you. If you do have supine hypertension, then you'd want to avoid water before bed. Small frequent meals is something that we may recommend as well. And so for some patients who are tired, this may be beneficial. For some patients who experience postprandial hypertension or their blood pressure drops after eating a large meal, this may be something that might be helpful. And then for people who have a decreased appetite, small frequent meals may be helpful as well. My patients who are tired don't feel like they have enough energy to finish a small meal or a large meal. Sometimes something smaller may be doable. So thinking about a little bit of cheese and some grapes, or some crackers and some cheese, or half a sandwich, for example, sometimes is easier than to sit down to a large meal. The same with decreased appetite. I have some patients that just don't get hungry. And so the last thing they want to do is sit down to a large meal or put a lot of food in their mouth. But sometimes thinking about something small, a little bit of oatmeal with some honey and some almonds, or like some carrot sticks and some hummus or some peanut butter, just small snacks throughout the day, is manageable and reasonable and doable. And then also about the drop in blood pressure after eating. Usually that occurs after a large meal, so eating smaller meals throughout the day may be beneficial for that. Some of my patients also have difficulty chewing. So I recommend to change up the texture, overcook the food, like noodles or vegetables, kind of making sure it's fork tender or, so that you can sit there and just cut it with a fork. Cooking meats in a way that make them moist, stewing, braising, baking them in liquid, chopping them up in small pieces. Cutting foods up can make it easier so you don't have to chew as long. And you want to think about, looking at the tip of your pinky and maybe putting about half that size. That would be the goal of what you would want to do. There's some countertop food choppers that are not very expensive that you could use to do the work for you as well. Be careful if you're reheating foods in the microwave, especially like pizza, for example. Sometimes the microwave can make things more tough, so you want to be mindful of that. You can add sauces and gravies. You can choose soft proteins. Sometimes chicken and beef is harder to chew because of the muscle. So choosing things like fish is out of water, fish is moist. So sometimes that's easier to chew. Ground up turkey or beef, even ground up chicken as well. You could think of things like a meatloaf or like a patty, adding an egg, adding some breadcrumbs, making that more moist. Fattier cuts of meat like chicken thighs. Sometimes those are easier to chew versus something that's more dry like a chicken breast. And then the veggie sources of protein like beans, tofu, eggs, cottage cheese, Greek yogurt, regular yogurt. Fruits, you can have soft peeled fruits, canned. Sometimes fruits that have a lot of water though, like watermelon, can be more difficult to chew. Some of my patients have difficulty swallowing. So again, some of the practices for difficulty chewing can also be helpful with difficulty swallowing. You want to make sure things are cut up well. Sometimes avoiding foods that have both solid and liquid together can be helpful. Think about like chicken noodle soup. You have the noodles, you have the chicken, and you have the broth. And then sometimes those pieces in that broth make it confusing to swallow and can lead to choking. Cereal with milk is something also that might be more difficult. So trying to avoid those foods can be helpful. Talk to your medical provider if you find that you're needing to clear your throat when eating solid foods, or kind of having that feeling when your food gets stuck. If you're having difficulty swallowing your pills, or if you feel like they get stuck, if you're coughing after drinking thin liquids like a tea or a coffee, if you're choking on solid foods such as meat or toast, or if you notice that you have like a wet or a gurgly voice after having your drink, that difficulty swallowing can lead you to maybe not eating as much. It also can it may cause aspiration, and that's where the food or liquid goes down the wrong way and may go into the lung, and that can cause pneumonia. Sometimes my patients have difficulty meeting needs by mouth for other reasons. And so when my patients are starting to tell me they're having difficulty swallowing and they're not getting enough nutrition, or they've had an aspiration event, or they're just not meeting their needs for whatever other reason, we start to think about what is our next step. And so that's when I'll start talking to my patients about the possibility of having a feeding tube placed. Now, some of my patients have not heard about it or don't know what it looks like. So I think it's helpful to know what it is and to understand how it's placed. And so a feeding tube is a device that's inserted into your abdomen. It can help you maintain good nutrition and hydration. And it doesn't mean that you have to stop eating. It is okay to eat and drink if it's safe for you to do so. And so if you see this bottom picture, this is usually what the feeding tube looks like. Now, every facility is a little bit different, and some of my patients have longer tubing. Sometimes they have a different tip. But overall, this is what, it's a tube that goes into the stomach, and you use it to provide adequate nutrition and fluids. On the right is something called a low profile feeding tube. This is something that they don't place initially. Normally they'll place this first one, and then within 3 to 6 months, depending on guidelines, you can ask your physician for the placement of a low profile feeding tube if you want. It's an outpatient procedure, usually takes an afternoon. You can use the tube 4 to 6 hours after placement, but a lot of facilities will ask you to wait 24 hours before starting to use it. And the next question is, what goes in it? Well, we use it for hydration. What a great way to get that extra fluid that you need. You can use it for some medications. If the medications are crushable or if the medications are liquid, you can put them through a tube. You cannot put extended release medications through your tube because they are created so that the medication is released over time. If it was crushed, then it would be released immediately, and that's not how the medication indicated and may cause other problems. So if you have a tube and you're wondering about medications, a really great resource is your pharmacist to find out what's possible. They do sell pill crushers, usually by a pharmacy too, and so that's something to invest in to make sure that that medication is crushed in a good way and then mixed with a little water so it can be flushed through the tube completely. A lot of my patients want to know what goes in it. Well, I call it tube feed. What is the tube feed and what's available? There's different kinds. There's commercial, and those are like Jevity or Nutrin, Impact, Osmolite. Those are all commercial ones, and those are all fine. They have adequate protein, fluids, and vitamins. There's also specialty formulas. So a couple of different brands, Kate Farms, which is allergen free. Real Food Blends, which is just food. It has like blended orange chicken or turkey and sweet potatoes. Liquid Hope, which is a plant-based organic whole food blend. And then there's one called Complete, which is also a plant-based, and they have both organic and non-organic whole food blends. Again, talk to your physician or your dietitian about what's appropriate for you. There's some insurance companies that will cover tube feed. There's some that will not. There's some that will only cover certain kinds. So again, please talk to your healthcare provider about this. I also have a question, from patients about, do I have to get a feeding tube? And that I ultimately say it's your choice. And I think having a conversation with your dietitian, physician, if you have access to a palliative care doctor, all of these disciplines can help you make the best choice about what's right for you. So now we're moving on to the live question and answer session.